Introduce yourself. If you're a male, then have a female companion, preferably a member of the medical staff. Explain the procedure to the patient, and place the patient on a dorsal lithotomy position, and choose the appropriate speculum for the patient. Put on gloves and observe aseptic technique throughout the procedure. Warm the vaginal speculum. You may add a lubricating gel on the exterior surface of the speculum. Hold the speculum with 2 fingers with the handle pointing backwards. Place 2 fingers into the introitus and press down to facilitate the entry of the speculum. So insert the speculum by placing the transverse diameter of the blades in the anterior-posterior position and guiding the blades through the introitus in a downward motion with the tips pointing toward the rectum. So once the blades are inserted, the speculum should be turned so that the transverse axis of the blade is in the transverse axis of the vagina. So open the blades midway through the vagina to avoid hitting the cervix. So once the cervix is visualized, the speculum is opened and that the introitus is widened. So this can be done by using the screw adjustment on the base of the speculum. So inspect the vaginal canal, and the vaginal epithelium is noted for evidence of erythema or lesions. The cervix is then inspected, and then take note of the erosions, shape, transformation zone. Sample the endocervical canal with the cytobrush or a cotton tip applicator, which is then placed into the canal and rotated. The material obtained is then smeared thinly on a microscopic slide by rotation of the swab or brush on the glass surface. This is labeled endocervix and then fixed immediately by use of a spray fixative with an iris spatula or some variation thereof. The entire transformation zone is then scraped. The sample is smeared thinly on the second slide, which is then immediately fixed and labeled transformation zone. Document and explain the findings to the patient and inform her what to expect after the procedure and when the results will be available. Ask the patient for any questions or clarifications.